Welcome to Learning Unit number 7. Learning Unit number 7 is our final full learning unit for this course. Learning Unit number 8, which is really our final course reflection, opens simultaneously with this learning unit. So, but you'll see the directions for Learning Unit number 8 and completing the final course reflection at the same time as you have availability to this one. So let's first talk about Learning Unit number 7. So our topic is the 8th, 9th, and 10th Caritas processes. So the 8th is creating a healing environment at all levels. The 9th is sustaining human dignity. And the 10th is being open to spirit and allowing for miracles. So we're going to apply all of Watson's Caritas processes in our final course reflection, but we are, for this learning unit, looking at 8, 9, and 10, especially the practice of creating a caring, healing workplace environment for the nurses that we lead. We're going to look at factors that have a significant impact on the retention of nurses. And we know that to be an effective leader, this requires us to address issues using creative as well as scientific problem-solving methods and ways of knowing and learning from other disciplines and cultures as well. And we're going to look a little bit at this as far as the indigenous worldview in one of the videos today. So proposals for enhancing a caring, healing environment for our staff as well as the patients that are served can be supported with evidence. We know that as these changes affect job satisfaction and retention. We're going to end this unit by reflecting on integrative nursing principle number 3, which is nature has healing and restorative properties that contribute to health and well-being. So let's look at the activities for this learning unit. You're going to read chapters 12, 13, and 14, because each chapter, as you know, goes through one Caritas process. But the page numbers that I specifically want you to read are listed here. You're watching this video, and it's not an audio, it's a video presentation. And then you're going to do a few other items here as far as learning activities. This is an evidence-based care sheet, and you know how I love Sinal's evidence-based care sheet, and it was updated in 2021, and it's on retaining healthcare personnel. So I want you to absolutely look at the evidence on retention, because we know how important retention is, especially during this time. And I've also posted a randomized controlled trial on the effects of a brief mindfulness-based program for healthcare professionals. So I think you may find this interesting. So that is also listed here. I've put the 6 integrative nursing principles down, and again, we're focusing on nature having healing and restorative properties that contribute to our health and well-being. The video that I'm asking you to watch is by Robin Wall Kimmerer. She wrote the book Braiding Sweetgrass, which is truly my favorite book. She's not a nurse. She's a botanist, and I ask you, and she's also an indigenous woman, and I just think the world for her and wanted to share this with you, and especially when she speaks about expanding consciousness of the needs of all beings. So I ask that you listen with an open mind to a non-nursing, non-medical discussion of integrating the indigenous worldview with the Western worldview. So isn't that integrative nursing has the same type of focus? She is a botanist, she's a professor, she's a storyteller, she's a poet, and again, she's an Indigenous woman who is an amazing author as well. So I think you'll enjoy this. Very different, perhaps, than what we've done before. The articles that you're going to be reading, one is an interview with Erica Timko Olson. Erica was in my cohort of nursing faculty fellowship program at the University of Arizona. And I think this is really speaking to being in nature. And we're going to look at biophilia, and the nature tincture is the name of the next article. So we're, again, integrating very diverse concepts into this one learning unit, so that we're really focusing on integrative nursing principle number 3 and 8, 9, and 10 Caritas processes. So it's a lot of information, but I've tried to select what I think you're going to find most helpful in addition to your text readings. So for the very last, and there's a tear in my eye as I say that, cultivating Caritas, please post an image or a photo of creating a caring, healing environment and why. And our last discussion board post for learning unit number 7 is asking you to share how the third integrative nursing principle contribute or can be integrated into our nursing leadership practice. So how can we integrate this third integrative nursing principle into practice? And I'd also am very interested to see how you thread together integrative nursing principle number 3 along with the other information that we're looking at, nurse retention and the Caritas processes 8, 9, and 10. So that is our very last discussion board. Please go on. Maybe at this particular time you might want to do it. You may want to complete learning unit 7 first. It's up to you. But please know that our final learning unit number 8 is also posted, and you'll want to look at that sooner than later so that you can complete your final course reflection as well. It's been a wonderful course. I know I have continued to learn from each of you, and thank you for your hard work and your sharing